So we're going to start, yeah?
That because of the way your phone is, that's making you 10 times bigger.
Me?
Yeah, makes you look 6'4".
Like that?
Yeah.
Okay. So, what we're going to stretch today?
Legs.
Legs, okay. So, I'm going to guide you through a series of stretches today. And this is so you can start practicing stretching with your child at home in a safe and gentle way. Children don't need a lot of stretching, but they do need a lot of activity. But the more activity they do, the easier it is to stretch. So creating a routine is important so that they can grow into a young athlete with good behaviors, good habits of stretching and taking care of themselves, looking after their body, and understanding that, sometimes we do have to do the work, and it's not all about the coach and the physio and the parent. Eventually they'll grow into that understanding that looking after the body comes down to themselves. So it will take a while for that to come through, of course, maybe even a few years, but this is what we do in any case with children. We help as much as they can do themselves, and gradually they take independence of those activities. And the stretching is no different. We're going to do exactly the same thing. We can stretch with them, and then eventually they'll learn how to stretch. And the good thing about it is, if they're not with you and they're on the football pitch or at school, and they notice there's a tightness in a muscle, they will know which stretch to use, and they will probably take the action and the initiative to stretch. And that's good because they're looking after the body as it happens, as it needs. So we're going to start with hamstring stretch. And this is a muscle that is very tight in many people, no different in children. So we always go slow, we always go gentle. But one of the things that we need to always be aware is that the child can communicate back to you how much you're stretching, how much it feels tense, and then the child also communicates when the tension eases. So we're not going to use time as such. We're not going to say 20 seconds, 30 seconds. We're going to go by feeling. So that communication needs to be present during the stretches. Okay, so I'm going to show you as well, not just communication, but positioning, because if you are a parent, you don't want to be bending over like this. You want to be able to have a good posture while you're doing, so you don't hurt yourself. So let's just get started. Okay, so we're here for hamstring stretches. You okay? Are you ready? Yeah. So the hamstring is the back of the thigh. And what we're going to do is all about just lifting the leg nice and floppy, nice and straight. And you ask the child to feel the tension build up here without pain. And the child will say, stop when they feel the tension. How's that?
Stop.
There you go. So I'm not forcing the foot. I'm just holding the leg up. The tension is here. And this is where you tell me when the tension eases. You just hold steady, no bouncing, no pushing through. And tell me when that changes. It's only a slight change. It doesn't have to be a big change. Different?
Yeah.
Okay, so that was already different, and we're going to bring it down. A good stretch is one that when you do it the second time, the movement goes further. That is a good stretch. So we're going to do it again just to test it, see if it worked. So I'm going to lift. I'm going nice and slow, so it gives time for the child to feel the tension. Tell me when. It's already past that point, isn't it?
Stop.
Yeah. Is the tension exactly the same as the first one? More? Less?
Yes.
Less. And we're going higher. So already there's a response from the muscle that is accepted the stretch. And that's why I call it gentle easy, pain-free. Tell me when to lower the leg.
No.
Now. And have you noticed how it didn't even take 30 seconds? Maybe for an adult could take 30 seconds, 40 seconds, sometimes even a minute. But really we're going by feeling. And some days could be longer, some days could be shorter, and we are respecting that. We fully respect that. So we're going to go for the other leg now. Same thing, nice and gentle. If you're doing on the floor, you go on your knees and protect your knees with a cushion. If you're doing on the bed as well, make sure the thigh is close to you, not too far. Tell me when. Stop. This is a bit tighter, isn't it? Is that too much?
No.
Okay. So never stretch too much. Communicate with your child. Ask. And if you think it's gone too much, they're going to squint their eye. Pay attention to that. And just lower the leg a little bit, lower the range. And that brings us back to the just the tension stretch rather than the pain stretch. How is it going?
Better.
Better. So we're going to go down. We're going to do 2 again just to test it. Yeah? Right, one more. Ready? Tell me when to stop. Similar tension, not too much, just enough. How's that? Oh, that's gone further, but a bit squinting there. Is that too much? Okay, we'll stay here then. And relax. Oh, higher. Oh, you want higher. And relax. The knee always straight if it's possible. If you've gone too far and bending the knee, the camera looks like it's bent, but it's not. Just lower the leg. You shouldn't be too high to the point that you can't keep the knee straight in a relaxed manner. Tell me when. Done? Yeah. Brilliant. Are you holding your breath? I think you are. So another thing is holding breath. We want to make sure they're breathing. Every time we hold breath, it's a message from the diaphragm to the brain and then to the muscle to say, you know what? Don't stretch. Don't go any further. So it holds more tension. So it's important to keep breathing in and out. So another way to stretch the hamstrings, if you are in bed, you can sit down by the side and lift the leg and even rest it on your shoulder. Just about. That's a nice way. So your hand's free and the leg is rested, and then bring it down. Okay. I need you to scoop up a little bit. All the way up. Oh, nice. Oh, you're right. Yeah. Okay. So here we're going to work on, I'm going to put a cushion on my knee. We're going to work on the calf muscles. This is a nice stretch for them to do it themselves. If you have a rope, they can wrap the rope around and pull and stretch. They can also do against the wall. But here, if you want to try, and also helps you understand, you know, which days your child's calf is getting a bit tighter. Sometimes could be, you know, the day of football, or the other days it seems to relax more. It's important because you can aim to stretch those days to make sure that the calf and the muscles are not holding tension. So I'm going to pull. Tell me when to stop. So I'm just holding the leg down so the knee doesn't bend and pulling the ankle towards his face. I say it nose, toes to nose. Yeah? You feel the tension? No? Oh, I have to go a bit harder. Okay. If you need to go a bit harder, that's a good thing. Put your hand, cup your hand, put it underneath the heel, and the sole of the foot is going to be resting on your forearm. And with that, you hold it like this. You can see. And in a straight pointing up to the ceiling, you can use your arm and your body, rock, slow, and lean, and then you get the stretch. Can you feel it now? Are you serious? Not the big one. Ready? How about now? Yes. Tell me when it eases. And make sure you are in a good posture, because sometimes if you have to use counter force with your own body, it can be tiring. So just make sure you are steady, balanced. That's good. What do you think? Done? Yeah? You're a bit quiet today. What's the matter? You usually don't stop talking. Okay, that ankle feels a bit tight. You know, sometimes you can move the body and know this is loose. This is a bit tight. So I think we'll be doing a good stretch there. Ready? So I'm cupping my hand under the heel, sole of the foot on the forearm, and I'm pulling too far. Tell me when. There? Yeah, it is tight, isn't it? But it's good that we're stretching. Have football tonight? Yeah. Yeah. You're going to be springing like a chicken. Right, I'm going to do one more on this one because it's much tighter. And this is something as well that you can consider doing, which is just repeat the stretch 2 or 3 times more than the other side if you feel it's really tight. Yeah. And then it's just about, again, testing. You know, you press the joint and pulling the foot back, and it's much looser already. So that was a really good stretch. Okay. I think we're going to go for the quads. Should we go for quads? Your back, your upper back, or lower back?
Everywhere.
Everywhere. We'll do back in a minute. Okay. Right. Go face down. How are you going to go face down?
Which way do we go? My head this way or that way?
Head that way. So knees there. That's it. So this is right, good. So this is a small sofa. If you're in bed, of course, the legs will be straight. But for the stretch of the quads, which are the front thighs, it doesn't really matter as long as they are comfortable, straight line. You don't want them twisted, and then you can do the stretch. And in this position, we're going to do 2 different stretches, 2 different muscles. But first, before you do the hip flexor stretches, which will be the next video, always do the quads first, because the quads are attached over the hip flexor muscles. And when you release the quads, it releases a little bit of the hip flexors. So by the time you get to the hip flexors, it's a bit looser. Okay, so sometimes the order makes a difference, but if you don't do in that order, it really don't worry about it. It's just, you know, unless you're doing as a routine. So here is about bending the knee. Okay, and Lena, you're going to tell me? Right. Thumbs up when you want me to stop. Okay? Ready?
Yeah.
Are you going to do thumbs up? I can't see your thumbs. Oh, that's a good one. Stop here.
It doesn't hurt.
A bit more. There.
Yeah.
And I'm pressing on the ankle. I'm not pressing on the foot. I'm not engaging the foot. And if you can see, there's about that much gap before the heel touches the bone. This is pretty good range, yeah? Eventually can touch the bum, but about 2 to 3 inches is considered quite good. And again, he's not feeling much tension. So I wouldn't push any further. It's pretty good. And we're going to go for the other side. Tell me again. I'm going to do thumbs up or tell me? Oh, that's a bit tight, isn't it? How's that? Tell me when. There. Okay, again. So a little bit more gap, which means this quad is a bit tighter than the right. But if you remember the hamstrings, the left one was tighter than the right. So muscle tightness can work like this, opposites, or sometimes same side. Tell me when.
No.
Oh, very good. Very good. Okay. Awesome. Okay, so now we're going to do the hip flexors. Hip flexors is a very important muscle for power for kicking, lower back pain, or strong core. Everything moves through the hip flexors and it supports the lower part of the body and the upper part of the body. It's always good to check if tension is building up in there. It doesn't mean you have to stretch every day, but by doing gentle stretches every so often, you have an idea if it's something you need to stretch. So this is a little bit more effort on your own body as the parent. So make sure the height is good for you. If you need to go on the knees, go on the knees, cushion your knees on the floor. But if they're in bed, it's going to be a little bit higher than the sofa, which is brilliant. But I'm going to do it anyway because I'm going to use my knees and pull from the knees rather than bending over like this. Okay. So for this one, the best way is, remember we cup the hand into the heel. You're going to cup the hand underneath the knee. And that's going to be your hook for you to lift this lever. So here, hand is under the knee. And all you have to do is, I'm using my legs, is to lift off the bed, sofa, table. Tell me when to stop. This is really good. Tell me when.
It's supposed to hurt.
So the stretch is a good question. You're supposed to feel the front pocket of your trousers. So if you have trousers and you put your hands in your pocket, it's going to feel right there. Okay, so the front of the hips. If they feel pain in the back, that means the muscle is really tight, and I would not push any point beyond where it feels tight or painful in the back, because it can make the back compress more and they can get back pain from it. So we're going to try again. Cup your hand under the knee and lift. Tell me when to stop. Really slow. You can put the hand on the bottom and press to hold the pelvis. Tell me when. Anything? Okay, I'm going to hold here. And again, you hold until the child notices a difference in tension. It doesn't have to be gone completely, but it just needs to be different, a little bit less. And I'm going to do it on the other one. Are you ready for the other one? Cup the hands under the knee. I'm bending my knees and I'm lifting with my knees, straightening my knees. Tell me when. How's that? How's that? More? There. There. That's enough, isn't it? And breathe. Remember to breathe. Always breathing, always breathing, always breathing. And down. Perfect. Really good. So here, if you have done a stretch while they are on the face down, it's always good to compensate the position of the back with knee to chest. So what you do, they can do it themselves, but this is what the movement is. Bringing knee to chest and holding to stretch the lower back. Done.